Thank God for another beautiful day, for another webinar. I welcome everyone to the call this morning. We have our permanent secretary in the house, the permanent secretary, Public Service Office, Ms. Oyegbola. You are welcome, ma. And I would like to welcome all the Alausa members that are on this call. Good morning to you all. Also, all the serving directors, all the colleagues, everyone on this call. Really appreciate you for joining us this morning. Thank you. And I would like to say Ramadan Kareem to all the Muslim faithful. I pray that the Almighty God will answer our prayer. Thank you so much for joining us. So without taking much of our time, the topic for this morning is cervical cancer. As we all know, that is a deadly disease that mainly affects female gender. You know, the first edition of this year, we talk about prostate diseases that mainly affect the male gender. So in order to balance it up, that is why the department came up with this topic this morning. So I want every one of us to listen attentively. And I believe that at the end of today's teaching, we are going to learn a lot from our facilitator this morning. So please sit back and enjoy the training. So let me quickly go through the profile of the facilitator for today. Her name is Dr. Oluwaseun Ayejoto, a medical doctor who is deeply committed to providing comprehensive and empathic care. Graduated with BSc in Human Physiology and MB BSc from Bowen University, Iwo in Osun State. She has worked in Lagos State University Teaching Hospital and the Lagos State Ministry of Health. She is passionate about youth and mental health care and actively engages in community programs, providing holistic care that addresses not only the physical, but also the emotional and physiological aspects of well-being. Our ultimate desire is to make a positive impact on people's lives. She enjoys books, music, movies, and good food. So on this note, I would like to invite the permanent secretary, Mrs. Sukanmi Oyegbola, to please declare the webinar open. Sorry, should we?
Thank you very much. Okay. Thank you very much, Mrs. Adeni.
You are welcome.
I say a very good morning to all our retired guys on the call this morning. I also, on behalf of the head of service, welcome everyone, serving directors, facilitator, and the post-service team to this call this morning. And I say, just like she has said, Ramadan Kareem to the Muslim faithful, and of course to the Christians that are also waiting on the Lord in fasting. My prayer is that all our prayers will be answered in Jesus' name.
Amen.
Now, this morning, the topic I think is very apt. March is the month of women. We just had the International Women's Day. So it's a time to look out for what are the issues that women have, which is why I consider this topic this morning to be very apt. So I would like to, on behalf of the head of service, Mr. Olabode Agoro, implore all of us to be attentive. It's not only the women now that should be attentive, the men as well, because I'm sure we have sisters, daughters, wives, nieces, all your female relatives. What you hear this morning, I'm sure we go a long way, or what you will hear this morning, we go a long way in ensuring that we preserve the health of our female gender. So on that note, I say welcome, listen, And of course, whatever it is that we learn this morning, I believe we are going to run with it. We're going to bring that lifestyle into our lives as well as teach others as well. Let's just spread the word. How do we help our women? Is this disease preventable? I hear it is. So let's hear from the experts in the house, and God will help us. Cancer will not be our portion in Jesus' name. Thank you very much,
Amen.
and God bless you.
Amen. Thank you, ma. So on this note, I will invite the Dr. Seun Ayejoto to please start the training. Doctor, you have the floor now. On mute. And
Good morning, ladies and gentlemen. I hope everyone can hear me.
we can hear you.
Yes, all right.
Yes, we can.
Okay, that's good. So I hope we're all doing very well this beautiful morning. I hope everyone is fine. I'm very honored and pleased to be having this health talk on cervical cancer today because as earlier speakers have talked about how important this disease is in our community and in our environment. And so without any delay, I would like to just delve into discussion. So I hope everyone can see the screen.
Yes. Yes, we can.
Okay. So cervical cancer is a cancer of the cervix, and the cervix is a part of the female reproductive organ. It is usually located between the uterus, which is where babies grow, and the vagina, which is the outlet that leads to the outer part of the genital area in women. Cervical cancer is very common, especially in developing countries like Nigeria, due to a number of reasons. Number one, we don't really have health-seeking behavior in our country. Before patients present to the hospital, usually when they're already seeing very serious symptoms of any illnesses. So people are not aware of cervical cancer as a whole, and so they do not undergo the screening programs that are made available now in order to detect cervical cancer on time. And the good thing about cervical cancer, it is the most successfully treated form of cancer, which means that if discovered early enough and effectively enough, you can be able to treat it and prevent further spread. So it's one of the cancers that have vaccines that are available to be able to prevent it. So early screening and getting the vaccine early on time is able to allow prevention of full-blown cervical cancer. Cervical cancer is so common that it's the third most common cancer in women all over the world. In Nigeria, it's even worse because it is the second most common cancer affecting women, with breast cancer being the first. And it's so severe in Nigeria that it's also the second most common cause of cancer-related deaths. That means that women that have cervical cancer, a lot of them die. It is every year there's about 12,000 cases that are discovered in Nigeria, and about 8,000 deaths occur every year from cervical cancer. That is to emphasize on how common it is and how much deaths are occurring because people are not detecting it on time. So this is just a diagram showing the cervix. This is the uterus and this is the vagina. I hope you can all see the cursor moving as I'm sharing it. So this is the body of the uterus. This is the vagina. So this midway between the uterus and the vagina is known as the cervix. The main cause of cervical cancer is human papillomavirus, known as HPV, which is a sexually transmitted infection. It is so common that it is responsible for more than 95% of cervical cancer cases that are present. There are about 100 strains, that means 100 types of HPV, the virus, but only about 15 of them lead to cancers. The most common types being type 16 and type 18. Type 16 is responsible for about 60% of cervical cancer cases, and type 18 is responsible for about 10% of cervical cancer cases. The interesting thing about HPV is that 80% of women have been infected at some point. So even some of us that are in this meeting, once you have been sexually active, there's a chance that you have been infected with HPV during the course of your life. But the good thing about it is that 90% of these infections are cleared by the immune system. That means that the white blood cells are able to fight the infection and prevent further spread. But in the remaining 10%, it will progress to what we know as CIN. That's like a precancerous stage, which could also now progress to cervical cancer. So this just emphasizes how long it takes for the infection to turn into a full-blown cervical cancer. It takes decades. We're talking between 10 and 20 years. So it's a long time, which would also help with screening program and also detecting very early. So if you're able to detect it very early, there are several treatments in place before it becomes full-blown cancer and prevents complications like death that may arise. So just a way of introducing just a general overview of how the infection takes place. Just so you know, the cervix is divided into two parts. You can see here, this is the endocervix, which is the part that is closer to the uterus, and the ectocervix, which is the part that is closer to the vagina here. So those two different parts have two different cells. The one that is closer to the uterus has what we know as columnar cells. The one that is closer to the ectocervix, which is the outer part, closer to the vagina. Sorry, the ectocervix is closer to the vagina, contains what we know as squamous epithelial cells. So there's a midway between these two cells where they meet, is known as the squamocolumnar junction. And surrounding that area is what we know as the transformation zone. This area is where immature cells occur. That's where they grow, or that's where they are. And it's by getting to this transformation zone, when the HPV gets to the transformation zone, that is able to turn into a full infection. So what generally happens is that during sexual intercourse, because again, like I said earlier, it's a sexually transmitted illness. So it occurs through skin-to-skin contact. The virus is being transferred from maybe the man to the woman. So it doesn't become a full infection until it is able to get to the lowermost part of the epithelium, which is the lowermost part of the skin. You can see here the basal membrane. Until it gets to this lowermost part, before it can actually become a full-blown infection. So the virus needs a break in the skin, which happens during sexual intercourse. There's some microabrasions. You're not able to see them, but there's some very tiny incisions that can be made, which will give leeway for the virus to get into the lowermost part of this layer. So when it gets there, it affects, I said earlier that immature cells are the ones that are around the transformation zone. Take, for example, there's someone having a cough in an environment, in a room. There's a child there and there's an adult there. If there's someone having a cough, the adult is able to cover their nose, cover their mouth to prevent the inhalation of these aerosols. But the child is really unable to, and so the child can get infected. So that's kind of like an example to understand how easy it is for the HPV to affect immature cells that are present in this transformation zone. So when it enters into these immature cells, it takes over replication and is able to multiply because it's able to produce some proteins called E6 and E7. I don't really want to bore us with all the finer details, but just so that these proteins that are being produced will go and stop these other proteins that are available to provide checkpoints. Normally for cells, there's a time for death. So there's a time that it's supposed to stop functioning and die. But because this HPV is able to produce these proteins to stop those cells that will originally tell those other cells to die. So they go and affect the checkpoints, and so they're able to produce abnormally. Because they're able to produce abnormally without any points in place, so they produce too many cells at a very fast rate. And that's what goes on to proliferate into cancer. So this is a picture showing how the proteins are being produced by this. So you can see this is the virus. It produces these proteins. The proteins will go and suppress some other proteins to now cause uncontrolled replication, which will not die. So the cells are producing at a rate that are faster than normal and they are not dying. So this is just a diagram to show the different stages. It doesn't just go from original infection to full-blown cancer. There are different stages involved. So you can see the grade 1 here. You can see that it's just a layer, just 1/3 of the epithelium that is affected. For grade 2, it's about 2/3 of the epithelium that is affected. For grade 3, it's about almost all of it is affected. For carcinoma in situ, it just means that the cancer is there, but it's only in the cervix. It doesn't spread. For invasive cancer, it's already spreading outside of the cervix. You can see that there's a break in the epithelium, so it's spreading to nearby organs. And they also have metastatic cancer, where it has spread to other organs through blood or lymphatic system. So this is the diagram showing the other places that you can get to. You can see here, this is the bladder. This here is the rectum, where poop comes out of. This is where bladder urine is produced. And you can also see the spread to the uterus, which is the upper part. You can see the spread to the vagina. We can also see the spread to the liver. This is the liver here. and then this is the lungs. So when it becomes too serious, it can spread to all different locations in the body, causing serious problems. I hope we all understood that brief pathophysiology. So this is just a diagram just showing how it progresses over time. So we can see again, emphasis on the number of years it takes for the initial infection to become full-blown cancer. So you can see this is giving us enough time to be able to screen, to detect, to do anything that we have to do before it becomes very, very serious, and it can lead to serious complications. So in addition to the HPV, which is the in addition to the HPV, which is the major cause of cervical cancer, we have other risk factors that can contribute or that can make contacting cervical cancer easy. So we have these that are related to HPV infection, which is any sort of sexual activity, you having sex with multiple people. The more people you have sex with, the more the chances that you're going to contract HPV, because one of these people could be carriers. If you're having sex with someone that's also having sex with other people, you can say, oh no, I'm only having sex with one person, I can't contract it. That is not to say, because the person you're having sex with could also be having sex with other people, which could also make you infected. And we also have to take into consideration, because a lot of people can say, oh, I'm not promiscuous, I'm not having a lot of sex, so like I don't think I have HPV. We also have to consider, especially in the case of children, children are getting assaulted more often these days. So you also have to take that into consideration. One sexual contact, you just have to have one sexual experience with someone that has the virus to be able to get it. So it's very easily contracted. We also have issue of sexually transmitted diseases. If you're already down with a sexually transmitted illness, it can cause some abrasions also and make it easy for the HPV to go down to the lowermost layer. Family history is not as common as having breast cancer, but if you have a family member, a first degree relative, an auntie, an uncle, an auntie, a mom, or even your sister that has cervical cancer, it's better to get yourself screened, because it could be some genetic predisposition to getting it. If you're a smoker, because nicotine releases some carcinogens into the body, carcinogens means that there are materials that can lead to cancers. You also have to be very cautious, because there's a chance that you are providing an avenue for cancer to develop. If you're using oral contraceptives, that is the oral pills to prevent pregnancy, it has been found, some research has been done, and it has been found that people that have used oral contraceptives over the course of 5 or more years are more susceptible. The reason is not exactly known, but some people have said that when people are on oral contraceptives, it's really to prevent pregnancies. So a lot of the times they don't use condoms in addition with the oral contraceptives they are using. And I've reiterated that HPV is contracted through sexual intercourse. So that skin to skin contact that you're having could still predispose you to getting the virus. If you have low immunity, you remember that I mentioned that 90% of the original infection is being cleared in people, in women. 90% of the time, your immune system will go and fight the infection. So if you have low immunity, if you are an HIV positive person, if you are on any form of chemotherapy where your immune system is down, it can predispose you to developing cancer or to having the virus. The low socioeconomic status is like in high poverty rates, or people that are not exactly financially buoyant. Number one, their nutritional status can be low, which means that they can be susceptible to these infections. They will also have poor information. They're not really made aware of cervical cancer and the screening mechanisms, and they're not even able to screen as often as they should. So this could contribute to why people get infected and develop cervical cancer. So patients that we see oftentimes, they can present asymptomatically, meaning that they do not have any symptoms, or in some cases they present with symptoms. It's important to note that when they present with symptoms, it means that the disease has gone very far. It is quite advanced, because in the early stages, they do not have any symptoms. So this is why we emphasize on the importance, why we emphasize on the importance of screening programs. So they are able to check for if you have any abnormal cells that could progress into full-blown cancer. So sometimes they do not have any symptoms, you just find it on screening. But for those that have symptoms, that means, like I said, the disease is already advanced. The most important symptom that they present with is vaginal bleeding. Because cervical cancer is usually seen in patients that are between the ages of 50 and 60. Most patients in that age group, or most women in that age group, have already stopped seeing their period. So they are postmenopausal. So having blood coming out of your vagina when you're no longer seeing your period is also an alarm sign. That is to show that it is a problem. Someone will have this bleeding after sex, postcoital bleeding. So the bleeding comes after they've had sex. They will notice that, oh, there's blood coming out of the vagina. In some cases, if you're still seeing your period, you may get some bleeding in between your periods. That shows that there's something abnormal going on. In some cases, they would have vaginal discharge, which the major thing about this vaginal discharge is that it is very smelly, very smelly. So you can tell that this is a problem. They can have what we call cachexia, which is basically signs of malnutrition. So they've lost a lot of weight, they're looking very weak. They could present like that. In cases where it has spread to other parts of the body, when we have invasive carcinoma or metastatic carcinoma, they would present with symptoms coming from the organ that they have affected. So if it has spread to the bladder, they would have maybe pain while urinating. They'll be urinating a lot more times. They can see blood in their urine. If it has spread to the rectum, they would have constipation. They are not able to pass out stool as much as they can. If it has spread to the liver, they can have yellowness of the eyes. They can have abdominal pain. If it has spread to the lungs, they can have some cough. They can have hemoptysis, which is blood in sputum. When they cough, they are coughing out blood. If that spread to the spinal cord or the back area, it could cause some pain because it is impeding on the spinal cord. So these are just the symptoms that they can present with that let us know that, okay, there is a problem. So following the symptoms, of course, you as a doctor, you will take a proper history from the patient. You also check for other signs and symptoms. You will like to examine the vagina and also do a speculum examination. So this just show the other investigations that will be done to further ascertain that, yes, this patient has cervical cancer. So there's some to be able to confirm properly that, yes, this is cervical cancer, and to also confirm the staging, because like I said, there are different stages of cervical cancer. You have to take a sample from the cervix. So you take a sample and send it to the laboratory, and it's reviewed under the microscope to give us exactly what stage the cervical cancer is at, so we can know the kind of treatment that we can provide for the patient. So these other investigations that are listed, full blood count urinalysis, just check for spread to other organs and to make sure that no other thing is affected. So these are the stages of the cancer. After taking it to the lab to be examined, this is just a brief, I'll just go through it briefly. So the first stage, it's in the cervix, is that particular area, small in size relatively. In the second stage, that's spread to the vagina, but it's in the upper part of the vagina. So we have it in the upper third of the vagina. In the third stage, we have it spreading throughout the vagina. So we have it in the cervix and also the vagina. It can even also spread to the uterus in this area. For the fourth stage, that means it is invasive, it is metastatic, it has spread to adjacent organs and also spread, so it has spread to the bladder, which is in front of the uterus, and has spread to the rectum, which is at the back of the uterus. It has also spread to other parts of the body. So when you examine the patient using what we call the colposcope, this is the machine. When the patient comes in, it sends light to the vagina. You can see this is speculum. This I'm pointing to is the speculum. So you put the speculum in to open it up. Then you use the colposcope to check. This is the cervical area. So normally this is what you get if there is no problem. This is the image that you get when there's no problem. If there is a problem, then you get to see, you can see the discoloration, you can see this whitish area. That's true that there's an issue. You have to take a sample and send it to the lab. So now the general treatment of the patient. How you treat the patient depends on various reasons. I said that you will send the sample to the lab to be examined. So depending on the stage of the disease, after you get the histology results, that will determine the type of treatment the patient will get. We also have to take other things into consideration, like the age of the patient, the financial capability of the patient. If the patient still wants to have children, you also have to take that into account when you're considering the kind of treatment you want to offer to the patient. In a country like Nigeria, you also have to take into consideration the facilities that are available. You know, some hospitals are not very well equipped for this kind of treatment. So you have to take that into consideration as well. So the various options include surgery, where you remove a certain part or the infected part of the cervix. You might also have to take out the whole uterus if the patient is old, they have completed their family, or if the spread is very advanced. So it's better to take all those out and to prevent further damage. You can also do what we call radiotherapy, which is where they pass through a beam. This is what the radiotherapy is. So this is the surgery. Take out this part, or you take out the whole uterus and part of the vagina even. You can also do, this is what we call the radiation. So they are placed in this bed, they move in, and the rays are being passed through the particular area to provide some treatment. You can also have what we call chemotherapy. This is just drugs. They are given intravenously to help with the illness. So, like I said, different stages require different treatments. If it is discovered in the CIN, that is when it has not gone into full-blown cancer, there are some intravaginal drugs that can be given. And you can also do what we call cryosurgery, where you use liquid nitrogen to be able to destroy those cells and prevent further spread. So this is the cryosurgery, the liquid nitrogen. So it is very important to get diagnosed early, because the earlier you get diagnosed, that means that it's most likely going to be in an early stage. If you discovered when it is in the early stages, you can see here that the percentage of survival is much higher. We're seeing 97, which is very, very good, up to even 70 in stage 2. If it is discovered in the later stages, which is stage 4, we can see how low the percentage is compared to the other ones. So you can see that further down the line, or the more advanced it is, the less likely the chances of survival because of the spread to other organs. So to the screening and the prevention, which is the major crux of this presentation. The screening programs are done routinely for women between the ages of 21 to 65 in order to detect if the patient has any abnormal cells that could lead to cancer. So you could say, oh, I don't have any symptoms, or oh, I'm not sexually active at the moment, I don't need to get screened. No, the test is exactly for people that do not have symptoms. That is the whole point of screening examinations. They are done for people who do not have any symptoms, to be able to find abnormal cells before they become full-blown cancers. So you go to the hospital and you do the test. There are different screening tests available, but the most popular one is pap smear, also known as Papa Nicolau test. We also have what is called HPV serology, where they take samples from the cervix to be able to test for HPV. You know, I said it's responsible for 95% of the cervical cancer cases. So it's important for you to check for HPV and also to do the pap smear. We have this visual inspection with acetic acid available even in our staff clinic here, where they wash with acetic acid and they inspect, check for any abnormal discoloration of the cells available there. So the type of test you want to get depends on you. But what is important is to get screened. That's what is very, very important. Make sure you go to the hospital and you get tested. So what to expect during pap smear? It can be a little bit uncomfortable, but it's just temporary. A speculum is being placed in your vagina. You're told to lie down and spread your legs. A speculum is being placed in your vagina. And this thing called a pap brush is being placed into to take samples from the cervix. That's the samples are sent to the lab where they are viewed under the microscope, and you can tell if there are any abnormal cells. So if there are no abnormal cells, you're told to come back in another 3 years to do another check, just to make sure. So every 3 years, you do pap smear testing every 3 years. If you're doing the HPV serology, you're doing it every 5 years. If you're doing the combination of the two, you're doing those every 5 years. So between the ages of 21 and 65, you're advised to do regular screening tests every 3 years to check for abnormal cells. So you can see that there's a clear difference in the normal pap smear results. You can see this is how the normal cells look. They're small. You can see the center, this darkened thing in the center, small compared to the remainder of the cell. But you can see in the abnormal pap smear results, you can see how big this center is, the nucleus. That shows that there's an abnormal thing happening. And then you can also see some things in between. I don't want to bore through the details, but you can see that there's a clear difference between the normal cells and the abnormal cells on pap smear. So for prevention, I think we're all familiar with the 3 tiers of prevention generally. We have the primary prevention, the secondary prevention, and the tertiary prevention. For the primary prevention, this is what we do to children and also inform of this health talk like what we're having today. We're supposed to inform the public of the dangers of cervical cancer, how to prevent it, and the importance of vaccination, especially for our young children. So I'm sure that a lot of us here have children that are young. Some might even have grandchildren that are within the age range of 9 to 13 who can get the vaccines. The vaccines are readily available currently in Lagos State as primary health centers. So if you have a primary health center that is close to you presently, you can have your children, you can take your children to primary health center. It is available free of charge for girls through primary health centers in Lagos currently. So we have to applaud Lagos State government for implementing that. And health talks like this could also inform the general public of the dangers of cervical cancer and the importance of screening and also sexual behavior so that you're very careful with who you have sex with. Secondary prevention is for people that are already within the age range of 21 to 65. So here you're telling them to get screened as much as possible or as adequately as possible. You're also doing routine checks, so routine pap smears and routine HPV checks to check for high risk HPV types. So that they can detect their abnormal cells as soon as possible. For the tertiary prevention, here you're providing adequate treatment, adequate and effective treatment to people that already have full-blown cervical cancer. And also you're doing pain management for them, which is a form of palliative care. So for the vaccines, there are currently 2 vaccines available. In fact, the vaccines are so effective that they have in the US, since they were implemented in 2006, they have dropped cervical cancer cases. 80% of cervical cancer cases have been eradicated due to the vaccines. So you can see how effective the vaccines have been so far. So I think if we have children, like I said earlier, it's better for you to get them vaccinated as soon as possible because they are not yet sexually active. The reason why that age group is very important between the age of 9 and 14 is that most of them are not sexually active. They've not had their first sexual experience. So they have not been infected at all with that virus. And so the vaccine is able to go and trigger an immune response and create antibodies that are available to fight against the infection should they get infected in their later years or through sexual intercourse. So this is just an example of the vaccine. So in summary, with everything that I've said so far, I hope we're able to get some major pointers. With the first one being that cervical cancer is one of the leading causes of death amongst women, especially in Nigeria. Because of poor information, people are not they're not spoken to, they're not advised, they do not really know about cervical cancer. That's again the importance of health talks like this to be able to inform us of the dangers of cervical cancer and also how important it is to get screened and tested for it. As we know that HPV is the major cause of cervical cancer, there are vaccines currently available for children that they can get free of charge in Lagos in any primary health center. And if you're already in the age range where you're sexually active and maybe would have been exposed, it's advised that you get a pap smear done or an HPV serology done at any hospital around you. It is readily available in a lot of government hospitals and even in some private hospitals, if that is your preference. So you make sure you don't just do one screening program or one pap smear and sit down in your house and say, oh, that one was fine. That is not it. No. I've emphasized on how long it takes for the disease to transform into full-blown cancer. So it's important for us to get regular screening tests done because it can develop at any point. When you're checking every 3 years, you're able to be in control of whatever outcome it is. So when there's an abnormal, when there are abnormal cells found, the doctor is able to counsel you on the next course of action. Again, symptoms do not readily appear in the early stages of cervical cancer. So because you're fine, you don't have any symptoms, does not mean that you do not have a form of cervical cancer or even you don't have the pre-cancer. So it's important again to get tested because you might not have symptoms. The treatment is dependent on the stage where it's discovered. And so when you discover it, it's better to get treated as soon as possible. And also know that survival is higher if it is found and treated early. Again, vaccines are very effective. They have brought down the rates in other countries like the US and the UK. And so we're trying to get that done also in Nigeria. So vaccines are very, very effective. So just generally, lifestyle modification, like proper health seeking behavior, having this information at the tip of your fingers, going to the hospital when you detect anything, getting these adequate screenings done, and providing help for those that are already, if they have cervical cancer, getting the treatment done as soon as possible would help to reduce the incidence and the complications of this disease. So if detected on time, they can be treated on time. So the earlier you detect it, the better your chances. So I hope that we have all been able to learn a thing or two. January is known as Cervical Cancer Awareness Month. So in January, there's usually a lot of free pap smear screenings happening across different hospitals. So if you have never had a pap smear test done, I would advise that you do so as soon as this lecture is done within the week. If you have done one and you have not followed up with others, I would advise that you do so. If you have done some and you have been regular. I applaud you for that. So I hope that we're able to tell a friend if you have children that are within that age range, take them to the hospital to get vaccinated. If you discover you have some abnormal cells, this is not the end of the world. You can get some treatments done that can prevent further spread. So I hope that we are all informed and we have learned a thing or two from this lecture. Thank you so much for listening and God bless.
Thank you so much, Dr. Shem, for the section. Very, very educative. And I believe that we've learned one or two things or more than one or two things from this morning's lecture. So before we go into the question and answer section, I will quickly run through what I jotted down. She talked about the cervical cancer, how it's on high side in the developing countries compared to the developed world, and the causes of cervical cancer. She also talked about the stages, what causes it, the stages, and how it can be prevented, and the kind of life that one needs to live. And she also talked about the symptoms of cervical cancer, also the treatment. And the bottom line is that all against child, they can be vaccinated. That is, they can be prevented from having such in the nearest future. And also for those of us that are active, that are adults, she also advised us to go for pap smear test on regular basis. So prevention is better than cure. And another thing is that we should be our brother's keeper. We can inform others. There are so many people out there that don't even know anything about cervical cancer. Let us try as much as possible, especially the girl's child, all our teenagers. Let us try as much as possible to talk to them and let them know how to live their life. And I pray that we will not experience this kind of disease in the mighty name of Jesus. So on this note, if you have questions, you can send your question as a chat or you raise your hand. So I will unmute you from. Okay, I would like to invite Chief Mrs. Coker. Please ask your question.
Good morning,
Okay.
doctor.
Okay, go ahead, ma.
Good morning. You said for children between 9 and 14, their chances of getting it is slim. What are those people who are no more sexually active? What are their chances of getting the illness? Thank you.
Okay. Doctor? Please, doctor.
Okay. Good morning,
Okay.
ma. Thank you so much for the question. I hope you can hear me.
Yes, go ahead.
Yes, please.
Okay, for those who are no longer sexually active, remember that I reiterated that the virus takes a long time to be able to become full-blown cancer. So if you have been infected at any point in your life, it might manifest very late. That's why it is important to get the screening done so that you can be able to detect it on time. So if you have had sex at any point, this is for people that have been sexually active in the past, you can have the virus in your body, which could be replicating at a very slow rate. So you can still have cervical cancer as long as you have been exposed sexually. That's what I mean. I hope that I'll be able to answer your question.
Yes, please. Thank you.
Okay. I see another person raising her hand. Mrs. Folashade Osho, please go ahead with your question.
Yes, ma.
Okay.
Okay, ma. I want us to enlighten us about the hospital whereby people can have this test. The only place I know very well was Lute. And I don't know whether other general hospital have all this equipment too. Thank you, ma.
Okay, doctor.
Okay, thank you, Ma, for the question. Like I said, every general hospital across Nigeria has cervical cancer screening so that they have the different tests. Even in our staff clinic here in Alausa, we have the one that we do with visual inspection with acetic acid. It's not pap smear, but it's also a form of screening, which we do every Wednesday. So if you are around and you want to get it done, you can come on Wednesday, like today, and have it done for you. And it's free here. So every general hospital, every government hospital has screening programs available. And oftentimes through the year, there are some organizations that organize free pap smear for people within the ages of 21 to 65. So if you are aware or you have some information regarding that, especially in January, because that is the Cervical Cancer Awareness Month, is available. You can walk into any of these centers. Even if you want to get it done tomorrow, any general hospital close to you has these facilities available. So you can just go there and they'll get it done for you. Thank you.
Okay. Thank you, doctor. Somebody asked
I hope
here.
that's enough. I hope that's fine for you. The answer.
Okay, Mrs. Kudirat Olatunji, please ask your question.
Good morning.
Good morning, ma'am.
Thank you very much, Dr. Seun. My own question is, though I joined late, this HPV, what do you mean by HPV? I would like to, you say it's one of the causes, it's like you say it's the major cause of cervical cancer. So I just want to know what you mean by HPV.
Oh, okay. So, like I said, HPV is called human papilloma virus. It is a sexually transmitted disease, like you have like gonorrhea and chlamydia. It's a virus. So what happens is that when you are infected, it goes to the cells and infects the cells. So when it infects the cells, it begins to multiply by itself. But the period from the new infection to the full-blown cancer is usually over the course of decades. So it takes a long time to manifest as full-blown cancer. And that is an advantage to us as women because if you get screened as often as you should, chances are you'll be able to catch it before it becomes full-blown cancer. And the adequate treatment can be given. So HPV, just know that HPV is one of the major causes of cervical cancer. If you get, and a lot of women have been infected. Once they've been sexually active, HPV is a very common virus. So once you're sexually active in your lifetime, there's a chance that you have the virus in your body. But the good thing about it is that in 90% of women or in 90% of cases, the immune system will go and clear the infection. So your body is going to fight the infection. But in some other cases, it doesn't fight it, maybe because it's able to replicate quickly, or the patient has some other infections, or the person has other infections that prevent the body from fighting it. So when it becomes a full-blown infection, is without caution over the course of years. So what you need to take is that it's a virus. It is very common. It's the one that causes full-blown cancer and is responsible for a large amount of cervical cancer cases. I hope that that is enough.
Thank you
If
very
you want
much.
me to explain, I can explain.
Okay. Thank you so much, doctor. Please, before we continue with the question, I would like to respectfully welcome our head of service to this call. You are welcome, sir. Good morning, sir.
Good morning. Thank you very much.
Welcome.
Good morning.
Thank you, sir. Welcome, sir.
Yeah, thank you.
Thank you for joining us, sir.
Pleasure.
Thank you, sir. So we have another question on the chat. Somebody said, how often can people above 60 go for pap smear test? How often can they go for the test?
Okay, thank you very much for the question. Like I said earlier, the screening programs are available for women between the ages of 21 to 65. So until you're 65, before you are able to stop, and you don't stop on your own, you stop because the doctor advises you to do so. The reason why we're able to stop is if you have been able to get at least 3 to 5 consecutive tests that are okay. It's the age of maybe through your 50s. And every 3 years, your tests come out normally. the chance of you now getting the infection when you're after 60 is really slim because you have been screening properly for it. So when you're already above 65, the chances are reduced. So for 60, you can still get routinely checked every 3 years until you get 60, until you are cleared by the doctor at the age of 65. So it's important for you to have routine checks that are very normal. If you have any abnormal tests, you have to continue screening. But if the tests you're doing are fine, no abnormal cells, then you'll be told to stop after the age of 65. Thank you. I hope that's enough.
Okay, thank you so much. Any question again? Mrs. Kudirat, I believe you've already asked your question, or you have another one. Okay. Please go ahead.
No, I don't have any other questions. Sorry.
Okay,
I don't know.
okay. So
Thank you.
So far, I believe we've learned a lot about cervical cancer this morning. And like I said the other time when I was doing the recap, awareness is the key. Let us try as much as possible to be our brother's keeper, especially our girl's child. Let us try and teach them. Also, let's go for screening. Prevention is better, far, far better than cure. Let us go for screening. We have the facilities in government hospitals. Let us go there and get ourselves checked. So on this note, I want to say thank you to everybody for joining us this morning. And since we don't have any other question, I would like to respectfully invite the head of service to give us one or two advice on this morning topic. Sir, you have the floor, sir.
Good morning. Good morning, permanent secretaries here present, retired and serving, directors here present. Thank you very much. Good morning.
Good morning, sir.
Kapo, you work and never stumble. Maya, I see you there.
Good morning, sir.
Good morning, sir.
God bless you, sir.
You work and never stumble.
Maya, Ekongbe.
Thank you very much. Well, just a quick roundup. I mean, it was a very good presentation by the doctor. Thank you very much. And well, we just have to listen to the advice by the doctor to check ourselves, the ladies, and then the children. We make sure that they get checked on time as well, or to have their tests done. And general well-being anyway. For general health care, we should always, regularly have medical checkups, and which is very important to catch anything early. So I just, encourage everybody to do that. And I say thank you for tuning in. And good morning. Ekongbe.
Thank you, sir.
Thank you, sir.
Thank you. Thank you for the advice. So
thank you, head of service, sir. Thank you.
Thank you very much.
Before we do our normal greetings, I would like to invite the permanent secretary, Mrs. Sukami Oyegbola, to please declare to close the webinar for today. Please, permanent secretary, ma'am.
Thank you very much, Mrs. Adeniji. The head of service and all protocols duly established and observed. I'd like to thank everyone for tuning in today. I believe that we have learned a lot concerning how to prevent and how to screen for cervical cancer. And my takeaway here is that we must have the awareness. We must be faithful to our spouses and our partners. So it's not a function of, like Doctor said, oh, I'm only having intercourse with one person, and then your boo has a boo. So when your boo has a boo, there's a problem. So let's stay faithful. let's do screening regularly. And for the men folk, you need to also counsel your wife, your daughters, your nieces about what you have learned today. A lot of counseling needs to be done so that the awareness is carried all over, and then there is screening. And then for those that can take the vaccine, that will also be advised. On that note, I would like to, on behalf of the head of service, say a very warm thank you to all of you for taking time to join us today. We look forward to seeing you in another 2 weeks, God willing. And Ramadan Kareem once again to our Muslim faithfuls. But I also wish the Christian happy fasting. Thank you very much. God bless you. And to our doctor, thank you very much. Thank you very much. We appreciate your presentation. Thank you. God bless you.
Thank you so much, Ma. Thank you. So once again, I say thank you to all the members of the Alausa that are on this call. Thank you for joining us. Thank you for everybody for taking your time for joining us. So by the grace of God, in the next 2 weeks, we are going to be talking about finance, investment. So the link will be sent at the normal time. So let us try as much as possible to live LD. And once again, Ramadan Kareem to all our Muslim brothers and sisters and to all the Christians. So right now, let us all unmute and greet ourselves. Good morning. Please let us unmute and greet ourselves.
Good morning, everybody.
Good morning. Good morning.
Mr. Ajibade, good morning.
Good morning.
I said good morning to everybody. All this week.
Thank you for joining us.
Our HOS, good morning, sir.
Mr. Benjamin.
Olabi, Olayinka, good morning, ma.
Good morning, PS. Good morning, Mr. Ajibade.
Good morning.
Doctor.
Please, I want to morning you.
Good
Good morning.
Good morning, everyone. Have a wonderful day. God bless
Mama
you.
Yeti.
Good morning.
Good morning, everybody. Enjoy your day.
Good morning to the head of service, the permanent secretary of head of service, all members of ANAPS. Good morning to you all.
Thank you, sir.
Thank you so much. A wonderful job being done. I can see you are carrying your this is mentoring, which I like. You are doing well. Thank you very much. We appreciate you.
Dr. Ayejoto Oluwaseun, thank you so much. I will call you after the close of the webinar. Thank you. And my regards to Dr. Muritala. Thank you for today's lecture. I really enjoyed it. Thank you, everybody, all my Alaja friends on this call. Thank you so much. Thank you.
Kapo Baba. Thank you, sir.
Baba come Kitigbe o. Awela wa yi o.
Good morning, ma.
Èmi ò gbọ́dọ̀ pàyàwó yín o, pa méjì fún o.
Alájà.
Ẹ̀dẹ̀kú àwẹ̀ o.
Alájà.
Àwẹ̀ tí bá àwẹ̀ lọ sọ Ọlọ́run á ṣe gbogbo wa. Ẹ̀mí wa ṣe.
Good morning, sir.
Family
Good morning,
Thank you, sir.
Thank you.
Ayejoto, ma.
Good morning, ma.
Bẹ́ẹ̀ ni o, a ti ká wọn mú.
Àṣírí ti tú.
Thank you so much for believing in this program. We really appreciate you. You and your permanent secretary, we appreciate you for endorsing this program. You even showed us that you believe in it. That is why you are here physically. We thank you so much.
Mrs. Adekoye one.
Adekoye Fanta.
Adúpẹ́ lọ́wọ́ Ọlọ́run, èmi á ṣìkà o.
Hey,
Amima,
Mama B.
All right.
Thank you so
Okay,
much.
sir.
Take care. All right.
Thank you.
Bye.
So,
Thank you.
on this
Bye.
note, I will close the
Okay.
section. So, see you 2 weeks' time by the grace of God. Have a beautiful and lovely day and glorious week ahead. Stay
Same to
safe
you.
and live healthy. Bye-bye, everyone.
Thank you.
Bye. Thank you.
Bye. Bye to all the participants. You're
Bye.
welcome.